Today, we're taking a closer look at a major new study that could reshape how we think about intermittent catheterization. I'm your host, Vic Senese, and welcome to the UroNurse News Show. So, reusable versus single-use catheters. New data presented at the European Association of Urology Congress highlights findings from the COMPARE trial led by Bertel Bloch out of Erasmus Medical Center in Rotterdam. This was a multi-center, randomized controlled trial comparing reusable catheters to traditional single-use devices in patients performing intermittent catheterization. So let's break it down. The study included 386 patients, at least 16 years old, and performing catheterization at least twice daily. Participants were split into two groups, one using standard single-use catheters, the other using reusable catheters designed to last up to 2 weeks. Now here's where it gets interesting. Reusable catheters were rinsed before and after use with a solution similar to mouthwash, stored in a container with 2% sodium hypochlorite, that's bleach, and in a solution that was refreshed every 24 hours. Patients were expected to use the reusable catheter for at least 80% of their catheterizations. Main question: do reusable catheters increase the risk of urinary tract infections? That's always what they say. The answer based on this study is, wait for it, no. In the per protocol group, single-use catheters had a UTI rate of about 0.05 per month. Reusable catheters came in slightly lower at 0.04 per month. Statistically, that means there was no significant difference. This means reusable catheters were considered non-inferior in terms of infection risk. When it comes to safety, complications like urosepsis, hematuria, kidney infections, and strictures, well, they were similar between both groups. However, there is an important caveat. Minor side effects were higher with reusable catheters. About 21% of the patients reported mild issues, compared to about 5% in the single-use group. And most of those, urethral irritation. So maybe they're not getting that cleaning solution off the catheter is my guess. At 6 weeks, 26% of patients stopped using reusable catheters, primarily due to difficulty using them and that irritation that I was telling you about. By 12 months, that dropout rate decreased to about 11%. Now let's talk about patient experience. Patient using reusable catheters reported better convenience, improved catheter-related quality of life. But patients using single-use catheters reported higher satisfaction and easier use. Especially a lot of these single-use catheters come pre-lubricated, so they make it very convenient to use. Now, one major advantage, reusable catheters were more cost-effective. Yeah, that makes sense. So what does this mean for clinical practice? Reusable catheters appear just as safe in the short term. They do not increase UTI risk, and they may actually lower healthcare costs. But ease of use remains a challenge. Urethral irritation is more common, and proper cleaning protocols are critical. Researchers are continuing to study the reusable catheters, including extended beyond 2 weeks. The key question remains: what materials work best? What's the ideal cleaning solution? And how do we improve usability? Dr. Bloch summed it up this way: the question is no longer whether reusable catheters are acceptable, but whether continued reliance on single-use catheters still is. A lot of people are talking about the buildup at the dump sites because of all this single-use stuff that they throw away, especially medical equipment. Well, anyway, this is an evolving conversation, one that could have major implications for cost, sustainability, and patient care in urology. So to find out more, stay tuned to UroNurse News, because we'll bring you the news as soon as it comes out. Now, tomorrow on UroNurse News, a potential game changer in prostate cancer care. Does TULSA therapy outperform traditional radical prostatectomy when it comes to safety and recovery? New clinical data will reveal better 6-month safety outcomes, higher continence rates, and faster return to normal life. But here's the big question: what about long-term cancer control? Check out tomorrow at UroNurseNews.com.
UroNurse News every weekday at 9 a.m. Central Time. Be sure to like and subscribe.
When I don't know